So hello, everyone. Thanks for joining us. I hope you had a good networking session just now. You had a couple hours to network, that's all part of this conference. Is very important to network with as many people as you can. And this session is on public and private services. That's part of this final conference on the EU AFD research facility on inequalities. We're going to be looking at inequalities in terms of public and private services. After these panels, we heard on Africa, impact of climate change, inequality drivers, and we want to zoom in on public-private. Fiscal policy isn't the silver bullet to correct inequalities, and so the role of both public and private is crucial to help develop infrastructure and services and sustainably, as AFD wants to do. Including in conflict regions, which we'll touch on, in the Sahel, for instance. I've covered conflict zones, and I saw every time when I went to a conflict zone, I saw that you can't have security without development. You can't have, and vice versa. So that's where we're going to be attacking that side of development to try to bring security also to some regions in the world. Let's look quickly at the agenda. We'll have a scene setter with Shahra Razavi, Director of the Social Protection Department at the International Labor Organization, that's the ILO, and then 6 other speakers and Q&A and closing comments. And that Q&A is very, very key for all of you to get involved and look at your Slido, find the Slido at the bottom of your screen, and there you can send your questions, and keep in mind your hashtag. If you think of a good soundbite, or you hear a good soundbite, or you want to say it's a good soundbite to put out on Twitter, it's hashtag research inequalities. And we want to stay on time. So we hope that we have a lot of presentations. We want to make it as conversational as possible. My other guests are Lisa Chauvet, who's professor, development economist at the Université Paris-Dauphine. There's Mouksit Akim, who's the assistant professor of economics at Mohammed VI Polytechnique University in Marrakesh. We have Manuela de Allegri at the University of Heidelberg's Institute of Global Health. And we have Youssef Borga, the University of Luxembourg research associate, and Jaime Aragon Falomir, who is a researcher at CEPED, Université des Antilles, and Holger Kula, of GIZ, the Gesellschaft für internationale Zusammenarbeit, the GIZ, which translated means the Society for International Cooperation, a very large organization based in Germany. So a lot of voices that we're going to have to weave into this very fairly short, relatively short, considering the voices that we have. So let's get moving right away and start with a sort of a scene setter with Shahra Razavi of ILO. You are ex-chief of research, UN Women, ex-senior researcher at UN Research Institute for Social Development. So the perfect person to ask, how does investing in social protection services fight inequality? How does it fight inequality? We know that it does, but how does it?
Thanks, Chris, and it's great to be with you and to be with all these distinguished panelists here to this presentation. I'm really looking forward to listening. Now, on social protection, we know that investing resources in social protection systems has a very positive effect on reducing poverty. We know this from the lessons of history. We know this is how countries that emerged from wars and crises, developed. And we also know this from cross-country data that shows higher levels of social protection expenditure going hand in hand with lower poverty rates. And if I can just ask for people to have a quick glance at the first slide, I have 2 slides only that I'm going to show. So this first one here, you see poverty rates on the y-axis and expenditure on social protection as percentage of GDP on the x-axis. And you can see the kind of the very interesting relationship between these two. We also know that social protection is a very effective tool for reducing inequalities, which is something that we have been talking about in this conference quite a lot, inequalities between households. And again, we see this very clearly, particularly in the European countries, when we compare the kind of income inequalities, market income inequalities, if you like, compare them to the kind of inequalities that exist in income when we get to the disposable income, i.e. after people have paid taxes and transfers.
That's
and
right.
of course,
how does it reduce the income gap?
Well, exactly. It exactly does reduce the level of inequality. And if you look at the next slide, which we have here, we can see a lot of the European countries are clustering on the left-hand side of this axis. And we can see that the Gini coefficient is reduced once you add in the taxes and transfers. So inequality is reduced. And a lot of middle-income countries are clustered in the middle and more to your right, which shows that the effect is much less. And why? And the question is, of course, it's how we spend money, but it's also how much we spend. And it's very strongly, the effect on inequality is very strongly correlated with the level of expenditure, which is about 18% of GDP in high income countries. And then we have in low income countries, it goes to as low as 1% of GDP. So I think the real big message here and the takeaway point is that developing countries need to increase the percent of GDP they allocate to social protection, seeing this not as a kind of distraction from the sort of economic development, but really as a necessary investment, a precondition, if you like, for economic development and for social and political stability. Just in the same way that countries need to invest in roads and bridges and, the hard infrastructure, as we call it, we also need to really be thinking about investing in the social infrastructure, and social protection has a big role to play here. But what I really, please go ahead if you have.
But there's a limited capacity of developing countries to reduce market-based inequalities, right? Using social protection tools. Why is that?
Well, partly it's, as we say, there's a sort of the fiscal capacity is low in terms of the fact that you don't have a great part of the labor force that still continues to work in the informal economy, which means that they're not contributing, workers are not contributing to a kind of contributory welfare state, if you like, but also the enterprises that operate informally and workers who work informally are not also contributing to the tax base of those countries. So expanding the tax base is really important. Having income and wealth taxes is really important also in terms of being able for countries and governments to mobilize the resources that are needed in order to be able to spend, and also be able to beef up and to really increase the capacity of state institutions, social protection institutions, social security institutions that are in charge of putting in place the kind of administrative systems that are also needed to really deliver these benefits in a way that is accessible, that is accountable, and that reaches everyone. But I think one point I do want to emphasize here is that, apart from addressing kind of what we call life cycle contingencies, like when you get unemployed, when you're sick, we saw this in this crisis, sickness benefits are critical, unemployment benefits are critical. Also, pensions for when you're old and you want to have a retirement in kind of dignity, but also families with children. We know from global experience, families, households with children are at much higher risk of poverty, so they need benefits, child benefits, universal child benefits. All of these are transfers, social transfers that are needed and really need to be resources mobilized and then transfers made available. But what I really want to say is that, and as you said, I do have a strong background in gender. What is really important is for these transfer payments to work in tandem with investments in essential services, especially healthcare, childcare services, long-term care services. All of these are absolutely crucial.
Because these transfer payments are not enough. That's one part of it, right?
Absolutely. And, just think of it. Now we have, in the context of population aging, we have an aging population in high-income countries, but also increasingly also in middle-income and low-income countries too. So if you have a universal pensions, that's great. It takes us a very long way forward. But if you have pensions, but you don't have the kind of long-term care services that are affordable and of good quality, then people end up spending all of their pension on hiring, some help that they need in order to be able to sort of get on with their daily activities. Or if you have, child benefits, but you don't have any affordable childcare services. That is particularly crucial, I think, in terms of women's labor force participation, because having to do the care work for children really means that very often women end up doing, part-time work or informal work, or they get slotted, in and out of the labor market in a way that doesn't allow them to accumulate the kind of benefits that they need through a contributory system for having a decent pension. So these quality services, having accessible, affordable, and good quality care services in particular, I think is really important so that women can also play an important role in the economy. And these services really have a triple effect. They help countries build the capabilities of children, of people who need care. They help women, particularly reduce the time that they put into unpaid care activities. And we saw what happens in this crisis when those kind of activities grew, and it had a very detrimental impact on women's labor force participation. And also, you know, these care services are a very good engine for employment generation.
Yes,
and moving out of this crisis when whole sectors of the economy have been decimated. Investments in care services are one sure way of creating jobs. And if they come with social protection and there are quality jobs, then I think we really are able to reap that kind of triple dividend. And ILO estimates show that total sectoral employment in education and health and social care services is likely to increase by almost 1/4 between 2015 and 2030 due to the changes in population and demographic, and additional investments in the quality of care services and working conditions for care workers can really create, according to our estimations, about 78 million jobs in education, health, and social care sector alone. And the trick is that these are quality jobs.
Yeah, that's massive, isn't it?
Yeah, it is.
I think you finished your presentation at this point, right? That was it, I believe. Or did you have more to add to that?
Well, I can very happily stop here, but very happy to answer any questions or elaborations that you would like to have.
Okay, and well, I'm waiting for the audience to send in a few, and those of you on the panel, you're welcome also to jump in and offer some comment or questions. But one question that comes to my mind is, what about tax evasion? You talk about how taxation can help here in raising the money needed for these investments, but isn't tax evasion a major problem?
I know I was muted. Yes, it is a major problem. It is a problem that really does need global coordination on it. And that's why in the United Nations kind of Addis Ababa Action Agenda, which is a big kind of global framework for being able to really mobilize resources, financing for development. And in the Sustainable Development Goals, this is an issue that is highlighted as needing attention. And there needs to be global coordination on this issue. You know, closing tax havens. Tax havens really are a major problem. It robs all countries of resources that they need, but in particular, it robs developing countries of much needed resources that they need for investing in very important services that they need to have, as well as in other areas of expenditure. So I think that is a major, absolutely major concern. Being able to also have proper taxation of multinational corporations that currently evade paying sufficient taxation, that's also a major area. So there is a lot more that needs to be done in terms of being able to have countries coordinate globally so that we create a level playing field that all countries are able then to kind of mobilize resources domestically for the investments that they need to make.
And can you give me an example of investment, especially on the private side, because we know that there's only so much public investment, and every government is strapped. But there could be a lot of opportunity for private investment if it's done right. Where do you see that? Can you give us an example?
You mean in terms of private sector investment?
Yes.
Well, I mean, for example, there is obviously in let's say the care sector, there are opportunities for private sector investments, but these need to be very well regulated because we know in many countries, in many developing countries where there aren't enough public care services, there are kind of bottom-up developments of, you know, things like childcare services, long-term care services, childcare services in particular. But very often the problem with private sector investment in these sectors is that if they have to recuperate their running costs, it puts services beyond the reach of average families. So that's one concern, and that's why you need
inequality. There you have the happy few that have those services.
Absolutely, absolutely. You have the relatively better quality services if they're provided by the private sector that become available to people who can afford the fees, and those who don't have to rely on the few public services that exist. And the other problem is the conditions of work in some of these services.
Talking about labor, you got the informal sector that
absolutely.
is very much involved in the care sector, and you get them out of the informal, and into the formal sector, right?
Absolutely. Yeah, exactly. So there needs to be much better regulation of the private sector, particularly in these kind of services.
Without scaring away the private sector, too.
Yeah,
There has
exactly.
to be an opportunity for them.
Yeah.
To want to invest. What about, in terms of public-private, though? Some of these, can you give us a case where with the public being part of the investment, they're sort of sharing the risk, so that it is more attractive for a private sector company to invest?
Well, this is a big question it's a very contentious issue. That private sector comes in, when the profits are there, private sector gets it, and then public sector is brought in through these public-private partnerships to basically pick up the losses. So that is an issue of concern, and taxpayers have to pay for that. So I think that needs to be looked at much more closely. And in terms of the sector where the private sector has gone, very often it goes into sectors where the profitability is high. So in things, for example, that are desperately needed in developing countries, let's say water and sanitation.
Yeah.
These are predominantly public money that goes into it, public sector investment. And private sector investment, if it goes into it, it tends to go into, let's say, urban areas, more areas where more affluent households live, who can pay the service charges. When it comes to villages, remote areas, it's often public sector that goes there because the profitability motive cannot be met.
Yeah.
So there are, I think, some difficult issues to be looked at here, without, as you say, scaring away the private sector, because there is certainly a role for them to play.
You got to figure that out, otherwise you're going to continue this flight to the cities from all over the world. There's a flight to the cities.
Yeah.
So, okay, let's leave it at that. Shahra, thank you very much for setting the tone.
Thank you.
It's really great. And I think we're still on time. Let's move on to our next, actually two speakers. It's Lisa Chauvet, professor at the Université de Paris-Dauphine, at the Institut de Recherche pour le Développement, and Mouksit Akim, assistant professor of economics at the Mohammed VI University in Marrakesh. On taxation, as we've been just talking about, I guess we're going to push this along and drill deeper on taxation and inequality. Lisa, Mouksit, please.
Thank you, Chris, for giving me the floor. Can you see my slides?
Let's see.
Yeah.
We're going to make that shift momentarily.
So
I don't see them yet. Let's.
No.
There you go. You got it.
Thank you. Thank you very much. So I'm Lisa Chauvet. I'm now professor of economics at the Université Paris 1, Panthéon, Sorbonne, but at the time.
D'accord, ça a changé.
No, but no, yes, ça a changé. But
quand même à Paris still.
Anyway,
okay. Yeah.
So thank you for inviting us to present this TaxInec project, which is a project looking at the relationship between taxation and inequality, which has already been discussed a little bit. So the motivation for this project was the emerging consensus at the Addis Ababa International Conference that domestic resource mobilization, DRM, would be key in the financing of SDGs, and notably key to achieve SDG 10 on inequality. And so this is with in mind, we had in mind this question of whether this financing strategy would be relevant and adapted to achieve SDG 10. And so the project is articulated around three main questions. The first one being whether inequality improves or, on the contrary, deteriorates individuals' attitude towards taxation, with in mind this idea that if you want to raise and to increase domestic resource mobilization, then you will need people to be more willing to pay their taxes, notably in developing countries. And the second topic looks at the other way around relationship, that is whether increases in taxation and more generally episodes of fiscal consolidation affect health inequality. And finally, the subtopic looks at the incidence in terms of income distribution of different fiscal systems. And all three topics look at the evidence of sub-Saharan African countries. And topic 3 even examines 3 case studies, Côte d'Ivoire, Mali, and Senegal. So let me now sequentially present quickly these 3 topics. So on the first one, which beyond myself involved also Marin Ferry, Siavash Eslami, and Laure Pasquier-Doumer. Basically, what we do is we measure at the individual level the preferences of individuals for taxation. That is, whether they feel that it's important to pay taxes, whether they feel that not paying taxes is a problem. Just wait a Sorry about that. So whether people think that it is really important to pay their taxes, or on the contrary, whether their preference is for evading taxes. The originality of our study is that instead of that, we look at the level of inequality around individuals, and we distinguish between inequality close by, that is in their neighborhood, and inequality that is distant, that is whether, for example, with respect to the capital city. And the other originality is that we measure inequality not with income data, but rather with nightlight, measured the intensity of nightlight measured with satellite data. And this is the only way that we could measure neighboring inequality, because otherwise we wouldn't be able to have exhaustive information on income around individuals. So this is just an illustration of what we do. Think of individuals at the center of this circle. I don't know if you can see my mouse, but of the green circle. And we measure inequality within the circle around individuals. And we do that for different areas, whether it is 20 kilometers, 50 kilometers, or 70 kilometers away from people. And this is just for you to understand what is it that we measure and what is it that we do not measure with this data. On the right-hand side, you have the case of Johannesburg, as you can see, which ends up with a very low level of inequality given our measure. You have the Gini coefficient here that is very small compared to other areas, because overall there is the area is very unlighted, and despite the fact that we know that this city, for example, is very prone to income inequality. So we cannot measure income inequality, but we are able to measure spatial inequality in terms of nightlight, that is access to public good, which is electricity in this case. So what we find in this project is that what matters most, it seems, is local inequality, that is inequality nearby individuals, and that people that are living in areas which are more unequal are more willing to pay their taxes, or at least have a more positive attitude towards taxation. And we interpret this result as evidence of a higher demand for redistribution. Inequality that is measured on larger areas, that is further away from individual, is also important, but not for all individuals. And in that case, individuals that belong to the poorest segment of the population, or that are further away from the economic centers of the country, tend to be more prone, tend to be more sensitive to inequality, and to have a higher willingness to pay their taxes, a better attitude towards taxation when they are surrounded by inequality, probably because they perceive that they are going to benefit from this taxation through the provision of public goods. Now, if we wanted to derive some recommendation from this analysis, then it would be that indeed the demand for redistribution of individuals is very important if you want to increase their tax compliance, that is their willingness to pay their taxes, and whether they perceive that they can benefit from this taxation is very important, and that poor citizens that are located far away from the center, from the economic centers, that are located in regions that are very poor, would benefit more from and would be more likely to have a positive preference for positive preference for taxation in that case. Now, the second topic involves Hélène Erhardt and Marin Ferry, and has to do with the impact of fiscal consolidation episodes, be it through an increase in taxation or through a decrease in spending on health inequality. And so to achieve this analysis, we associate data on health outcome at the child level for more than 2 million children in 35 African countries with episodes of fiscal austerity around their birth date. That is, we look at whether the country was going through an increase in taxation or a decrease in public spending at the time of the birth of the child or during the pregnancy of the mom. And we find that kids that are exposed to this kind of episodes, to fiscal consolidation during their first year, have a higher probability to die within the first year of their lives, have a lower survival rate. And we even calculate the average effect, which is quite high. We find that it's an additional 6 to 7 per 1,000 deaths before the age of 1 for babies that are born during austerity. And we can then look at the inequality dimension by looking at kids that have a mom that belongs to the poorest segment of the distribution, that are poorest, and we find that those moms that have a lower income tend to be more exposed to this effect. The effect that we find is really driven by the poorest children, and notably when the fiscal consolidation occurs through spending cuts, which makes sense since these poorest men probably do not pay taxes, and therefore the tax increases may have no effect on their disposable income. But through tax cuts, they are affected in their health outcome or the health outcome of their kids. The effect is also driven by mothers belonging to the middle income segment of the population, but this time it's the tax hikes, the tax increases that matter, which again makes sense because these men are probably likely to pay taxes, and therefore an increase in these taxes would decrease the available income that they have to spend on health outcome. So this, in terms of recommendation, would suggest to indeed take into account the human cost of fiscal consolidation episodes, and this is going to be probably very relevant in the times ahead of us, since the COVID-19 crisis will probably put a lot of pressure on the budget balances of countries, and therefore to deal with these potential imbalances that may occur, taking into account this human cost in terms of kids' health, and notably at the poorest, for the poorest kids, is probably very important. And the spending cuts, if any, should really target expenditures that are not essential to the poorest children. I'm now going to give the floor to Akim, to Mouksit Akim.
Sorry, I was mute. Thank you, Lisa. So I'm going to talk a little bit about the third topic, which is about fiscal system incidence. So let's have a look at this picture representing a rod to get the 23 agenda SDGs. And I consider this long way to the SDGs like not a kind of straightforward, but you can think of like a rod with many turns, and each turns may represent a challenge. And from my point of view, one of the, and I'm sure many of you agree, one of the main challenges is how to finance these SDGs. And that's why Lisa said earlier that domestic resource mobilization is a key to achieve these SDGs, mainly because to achieve SDGs, we need more infrastructure in terms of health education. We need to set up an effective social protection. And a crucial component of this DRM is the fiscal system. And throughout this presentation, I want you to think of fiscal system not only like collecting taxes, but also how to use this revenue, this tax revenue, how this tax revenue is spent. Because this is important because when you collect tax, you may worsen the effect on poverty, because if you collect more taxes on poor people, you are likely to increase poverty in the country. You can see many evidence in the literature, like the works from CUQ Institute, finding that, you know, in some countries, in developing countries, fiscal system is likely to increase poverty. And we need to make sure also that, you know, the public spending, you know, are benefiting more to poor people. So a second challenge we need to think about is how this DRM align with SDGs, notably SDG 1, which is eliminating poverty, and SDG 10, which is reducing inequality. But to address this question, we need a rigorous analysis of fiscal incidence to understand what's going on about the existing fiscal systems. What lessons can we draw from these systems? And that's exactly what is talking about in this, what we are talking about in this project. And the objective of this project is to compare the fiscal systems incidence of 3 West African countries, mainly Mali, Senegal, and Cote d'Ivoire. And this is a joint work involving 3 other researchers, Mahdi Benjalloul from IPP, PSE, Léo Chaka from Université Catholique de Louvain, and Anne-Sophie Robiat from IRD, Leda Dial. Before getting the main results, I want just to talk a little bit about the approach we use to address this question. So basically, the principle of our approach is to compute 4 income concepts. The first one is the market income, which is income before any taxation. And from the market income to the disposable income, we add direct taxes, like personal income taxes. We subtract direct taxes, we subtract direct taxes, like income taxes, and we add the transfers, cash transfers from the government. And then we get the disposable income. And from the disposable income to the consumable income, we take into account the indirect taxes, typically value-added taxes or import taxes also, and we add subsidized. And then finally, from the consumable to the final income, we take in account, we account for in-kind benefits from public spending, typically public spending on education, for example.
So to do that, sorry to jump in here, but we have about 2 minutes left before we're supposed to go to
Okay,
Q&A.
I'm gonna go.
So if you could sum up in the next, say, 3 minutes, that would be great. Thank you.
Yes, sure. We combine many sources, household surveys, and we use an interesting platform, which is Open Fiscal. So quickly on the main results. So the main result we found is that we found a small contribution of the whole fiscal system on inequality. And this is explained by contrasted effects of each of the single fiscal instruments. We find, for example, that direct taxes are progressive, meaning richer people are paying more taxes in proportion of their income in comparison to poor people. On the contrary, indirect taxes are regressive, meaning that poor people are paying more indirect taxes in comparison to the rich population, which is quite surprising because in these countries we have large VAT exemptions, especially for food products, and we found that income benefits are progressive. So quickly on the recommendations, we have 3 recommendations. The first one is to expand the reach of direct personal income taxes by improving information system. What we are talking about here is, for example, to reduce the size of the informal sector, or at least to make the country more able to collect tax from informal sector. And the second recommendation is to re-examine the exemptions of the indirect taxes and to make them better targeted the poor people. And the third one is about the data, because when we were doing this exercise, we faced many challenges in terms of quality of household service data, and we have a lot of problem to get some fiscal data that would allow us to improve the quality of the analysis. So in conclusion, 3 main messages I want you to take away from this presentation. The first one is related to the first topic presented by Lisa. They show that there is a strong link between demand for redistribution and the willingness of individuals to pay taxes in Africa. And the second topic show that human cost associated with decrease in spendings, notably among poorest segment of the population. And finally, we found a small contribution of fiscal systems to SDG 10 due to contrasting effects of fiscal instruments. So thank you for your attention.
Thank you very much, Mouksit. Thank you. And thanks to Lisa. I think what I'm going to do is I do have a couple of questions here, but I'm going to save them for the Q&A later during the session so we can stay on time and move ahead to Manuela de Allegri at the University of Heidelberg's Institute of Global Health. And Manuela, you're going to be talking about health spending on Burkina Faso, Zambia, and Mali, right?
Malawi. Good afternoon, everybody, or I should say good day, in case somebody's following from a different time zone. I do not see my slides yet, Chris. I don't know if it's just me.
It might take a second or two. Here we go. You're all set.
Okay. So again, I'm very pleased to be here with all of you. My name is Manuela de Allegri. As Chris mentioned, I am at the Institute of Global Health in Heidelberg, Germany. I'm not German, though I'm Italian, as you can tell from my accent. And it's my pleasure to present work, which is actually not only my own work, but the work of a relatively large team of people listed on this first slide, and spanning the work across 3 countries. I'm gonna basically present my slide by looking first at what has motivated our work. And what has motivated our work was the observation that a number of policies have been set in place over the last few years to promote universal health coverage. We're looking specifically in this project at the health sector. And universal health coverage, as many of you know, is one of the fundamental goals stipulated within Sustainable Development Goal 3. And a lot of research has gone into assessing the effects and the equity effects of universal health coverage policies. But we noticed that very little research had actually been going into understanding if patterns of health spending had changed over time as a function of these policies, with the expectation we would hope to become more pro-poor, more equitable. And that is exactly the research question we set to try to answer. So we tried to understand if and to what extent the distribution of health spending had become more equitable as a function of the introduction of these policies, and to try and explore heterogeneity at multiple levels. So between different providers, for example, public versus private providers, mission hospitals versus public hospitals, looking at rural and urban settings, looking at different regions, different districts, a little bit also depending on data availability within each country. And the tool we used is a widely used tool to assess equality in health spending, used traditional economics, benefit incidence analysis. The only thing we did a bit differently is that instead of just looking at public spending, we looked also at overall spending. So we tried to also generate an assessment of the system as a whole. And in addition to this, we combined this econometric analysis with geospatial analysis. So one of our team members is a geographer, and he's very willing to follow me in my crazy idea that geospatial analysis can be combined with econometrics. And this was a learning experience together, so to say. We have worked, as Chris mentioned at the beginning, in 3 countries, Burkina Faso, Malawi, and Zambia, purposely selected because we knew that in these countries, a large number of reforms targeting universal coverage had taken place. And because we knew we needed access to a lot of data. So we needed to be well connected locally with good research partners, and in particular, have good policy links to be able to have access to this data. So I'll be very explicit as to why we've selected these countries. And what have we learned from our work? So as I mentioned at the beginning, we had 3 countries. We looked for developments over time, which means for each country we have 3 time points. We look at curative services and maternal care services across levels of care, public and overall spending, across providers. You can just imagine the amount of tables that we have generated with this study. So there is no way that in a 15 minutes presentation, I can present to you all the funding. And so what I've decided to do is that I'm going to tell you the story of what we found out by picking on selecting figures emerging from our study. Okay? So the first thing we learned is that inequalities have decreased. So there is a good news in our research. The good story is that as we moved over time, as universal coverage policies have been implemented, we observed consistently across the 3 countries a decrease in inequality. And how do you see this in this figure is that the red line represents the line of equality, and the closer, so anything that is below here represents a pro-least poor distribution, and anything that is above represents a pro-poor distribution. This is a very simple visual representation of our data using concentration curves. I forgot to say at the very beginning, the benefit incidence analysis ultimately boils down to a series of concentration curves whereby the benefits are measured in terms of really financial benefits, so to say. So the closer these lines are to the red line, the greater the equality. And you can see that the green line, here you have an example from Burkina Faso, gets even for this specific set of services, outpatient curative services, to become pro-poor in 2017, very markedly so for public spending, and also so when we look at overall spending. So when we also factor in donor and out-of-pocket expenditure. This is the good news. And this is the good news we observe across countries. It's not always exactly the same. I'm not going to tell you that across the 3 countries for each and every service we observe this pro-poor pattern, but across the 3 countries we observe decreases in inequality. And what we also consistently observe is that overall spending remains always or almost always more unequal than public spending. So when we factor in the fact that people also pay out of pocket, we observe greater inequalities than if we just look at public spending. And in a way that is not really surprising, I would say. Here, another thing that we can observe is that instead we're looking at inpatient. If you remember, my first set of results was looking at outpatient care. So another lesson learned is that if we look at inpatient services, so if we look at services delivered at higher levels of care, inequalities remain greater. And this is consistent across the countries. So gains in equality are there. They're stronger for outpatient and for inpatient services, and in general, they're stronger for curative compared to maternal care services. Here again, looking at Malawi, you can see Malawi is actually a special case, a country that has always resisted the introduction of user fees. So it's actually a country which has been consistently close to the equality line, at least for spending on public facilities. But as I mentioned before, the story changes if we look, for example, at private providers. So we do not necessarily have access to data that really allowed us to look at private for-profit, but we could look at private not-for-profit in some of these settings, like Zambia and Malawi, and we notice that in mission hospitals, inequalities remain larger than if we look at people accessing care in the public sector. And you could say, well, it's people's choice to go to a private provider. Well, it's not always a matter of choice, because sometimes in some districts, you just do not have access to private providers. So you are channeled towards private not-for-profit providers, and these providers are linked to the public system through service level agreements. So you would expect the same level of equality, but what we're actually observing is that there are greater inequalities remaining at this level. And this is, in looking at maternal care services, I purposely decided, instead of showing you more concentration curves, to look a little bit at these experiments of combining economic data with geospatial analysis. And what we've actually mapped is the results of our analysis. And what the geographer Emmanuel has also done, he has then also done what I call fancy geospatial analysis. So he has basically looked at potential correlations, so whether districts close to each other behave in a similar way over time. And what this series of graphs shows, so I'm just going to show you a series of graphs. Here we have Malawi, and here we have, for example, Zambia. So I guess I'm not allowed to go backwards on the slides. I wasn't expecting that, sorry. What I wanted to I am allowed. Fantastic, thank you. What I wanted to show is that what we see is that as we move over time, we become greener. All the countries become greener, okay? So reinforcing the story I mentioned before, we're moving towards more equality, but there are persistent heterogeneity within countries. So it's not like equality is the same everywhere. There are differences, and more research is needed to dig into these differences and try to explain them. So what conclusions do we draw from our work? Well, in the first place, I almost want to say, surprisingly, I wasn't expecting, even as the researcher who had the original idea to move in this direction, to observe such consistent decreases in inequalities, which we cannot relate to these policies in a causal manner, but which we can relate also because we have a deep understanding of this context. We've worked in these countries for a long time. We see that it works. Investing in universal health coverage pays off in terms of reducing inequality. However, pooled analysis can mask very important differences across regions, levels of care, and providers. So disaggregating analysis is fundamental to be able to tell the full story. We need further research. We had actually planned a lot of policy engagement. COVID came in the way and we couldn't travel to these settings. And more than not just being able to travel, everybody was very worried with COVID, and there was limited ability to really engage locally to fully unravel the causes of this heterogeneity. But this is absolutely planned as further work. And what we also conclude in terms of policy recommendation is that there is definitely a need to sustain the investments made so far. So not to let COVID come in the way a second time, but really say, let's sustain the investment made towards universal coverage and increase these investments to overcome current heterogeneity in terms of inequalities at regional level. We need to help people overcome distance barriers and access barriers not related to payments at point of care to ensure that also secondary services are equitably accessible to everybody. And most and foremost, I cannot dig into the details of it, but there were a lot of challenges in conducting this work related to data. So we learned a lot about what data would be needed for effective decision making. And we're actively working to promote better data for better decision making. Thank you very much for your attention, and I'm very happy to take any questions.
Well, thank you very much. Manuela. I'm still waiting for a question from the audience. Let's see, hang on. No, we got a question here. Hold on. Given your results, should the private sector play a role in extending universal health coverage? And if so, what role? That's a good question.
That's a very good question. So there is a major limitation to our work, as I mentioned earlier, and it's the fact that our costing data, so the data reflecting financial investments, come from national health accounts. And national health accounts do not always report all sources of spending in the private sector. So I can only offer a partial answer to that question because we really face the data limitation. But I would say absolutely. I mean, in Malawi, private not-for-profit mission hospitals play a fundamental role in service provision. The answer would probably be strengthen the service level agreements, make these agreements stronger, more effective, make sure that they're really implemented, that payments follow on time from government to the private sector in such a way that people are really enabled. Yeah.
But what do you imagine as far as private sector participation in this? Do you see it on a sort of a local doctor by doctor or clinic by clinic basis, or do you see something maybe making it attractive for a health management organization like an HMO that they have in the States, in the US, which would be more regional or even national private sector? I mean, what do you see most practical? Probably a local arrangements, right?
I think this really depends on the context. In both Zambia and Malawi, the mission hospitals, so to say, work in some sort of federation. So the service level agreements are established at the level of the central government. In Burkina Faso, the private sector is relatively limited and it's not yet working in federation. There is not yet something like an HMO, so you couldn't go for such an option. So I think the answer is really rather contextual. In general, we have looked at 3 countries where the private sector is still relatively small compared to, for example, if we had done this analysis in India or in Bangladesh. So one has to keep in mind this very strong contextual factor.
Okay. Before I move on, I think I got a minute to ask Holger, because Holger, I know you're on with us as a discussant, so you're not actually making, as far as I understand, you're not making a presentation. You are sort of giving feedback and discussing some of the different presentations. Can you give us your feedback on this one by Manuela? Sorry, yeah,
Manuela.
Hi to everybody. Yes, I'm Holger, working for GIZ, the German International Corporation. No, actually making a sort of connection to the very first into the second presentation as well. I mean, it becomes so clear that we face now challenges pre-COVID, let's say challenges in general, but now it's even more complicated. We have now a new situation because the challenges will be larger. So I see a sort of triangle. I appreciate what Paul said at the beginning. It's about the amount of money, because sometimes, there is a community not ready to speak about the amount. They say, it's only about how. No, there's also a larger question, a big question. How much are we ready, our societies in the South, but also in the North, ready to share and to invest? And then, of course, comes the question to that, how to mobilize, where to mobilize those resources, and then how to spend, actually, because just going through the different papers we have listened already, and we will still listen, it is about now watching into reality about COVID crisis. It's about, first of all, first aid, survival aid that is now at our table. Then it's about health. Now that was the last comment and the intervention. Now it's about health, because if you really want to make a change, this requires a huge amount. Then it's about education, it's about social protection. So if you already list all those issues we just have now, first of all, we have to link it. But that gives even evidence about the amount, the huge amount we need. That's something actually we have to face. And that message is very strong. It's all together. It's about how to mobilize and where to mobilize. Then it's about the amount, and then it's also about the how. That is also interlinked. And here I would, let's say, somehow recommend, because I was also asked at the very beginning to give a sort of comment or idea of what to do next. Because as I understood, the European Commission is very much, let's say, an expectation to see new period of that research. So following up the question, what has to be what needs to be done now? What is the sort of implementation you would, as a researcher, recommend? So I would, first of all, I would recommend to put all those three dots together, and then to draw some conclusions.
Okay, let's try to get back to that toward the Q&A after the break. Let's move on now, to stay on time, with Lucia Borga of the University of Luxembourg, research associate. You used to work with the Ethiopian Development Research Institute and even the Commercial Bank of Ethiopia. It's very interesting to see that sort of private sector side there. You're speaking now on social protection programs in Ethiopia, India, and Peru, workfare, employment guarantee, cash transfers. A lot of interesting issues there. Lucia, please.
Thank you, Chris. Hello, everyone. I'm pleased to have this opportunity to briefly present the summary of the research facility that the University of Luxembourg has conducted in the past couple of years. I'm presenting today a joint work with my colleagues, Professor Conchita D'Ambrosio and Raphael Catin. So the overall objective of this project was to conduct an original global thematic research on the drivers and dynamics of economic and social inequality, and how distributive spending policies come into play. To this end, we focused on so far understudied areas in this research arena, and we focused on evaluating three large-scale social protection programs in three different continents. These three programs are the Productive Safety Net Program, PSNP, in Ethiopia, the Mahatma Gandhi National Rural Employment Guarantee Act in India, and the Juntos Conditional Cash Transfer Program in Peru. And interestingly, these three large-scale programs came to fruition because of a coordinated effort by different stakeholders, including governments, donors, local authorities, as well as the individual beneficiaries themselves. We try to focus on three important areas of research. We ask whether these social protection programs, having in mind their different designs and setups, how do they affect multidimensional deprivation of individual beneficiaries? And then we zoom in a little bit into the household unit and try to see if the programs have an effect on the inter-household resource allocation, whether they have an effect in reducing or increasing within household inequality. And then we also try to see the wider picture again by looking at horizontal inequalities, inequalities between culturally and socially constructed groups. To give you a brief overview of these three programs, the first one is the PSNP, the Productive Safety Net Program in Ethiopia. It's a public works program, and it's launched in year 2005. And at the height of its implementation, about 8 million people benefited from the program. There are two wings into it. There is a public works arm to the program, where able-bodied individuals will work on public programs for cash payment. And in the event that the household does not have able-bodied individuals, then they will be directly supported by the program. And selection into the program was done through a mix of administrative as well as community inputs. The second program is the NREGA Mahatma Gandhi National Rural Employment Guarantee Act in India. It's an employment guarantee which was also launched in 2005, and it's a very large program, more than 180 million participants so far. And it guarantees 100 days of work per year at the minimum wage for individual participants. And the act was initially phased in at times to different districts within India, depending on their backwardness and poverty status. The third one is slightly different. It's a conditional cash transfer program, but interestingly enough, it's also launched in year 2005. And by 2016, approximately 2 million people were benefiting from that program. It's a cash transfer program under the condition that under 5 children receive antenatal care and growth monitoring, and children from age 6 to 14 attend at least 85% of the time at their local schools. So having met this condition, the household will receive about 100 nuevos soles, or it's roughly around 30 to 35 US dollar per month. So these are the 3 programs that we are focusing on. And if you're wondering what ties them together, fortunately for us, there is this international longitudinal study called the Young Life Survey. It's data that follows the lives of about 12,000 children and their families, as well as their communities in 4 developing and middle-income countries. 3 of them are Ethiopia, India, and Peru. And fortunately for us, it made our task much easier because we have surveys before the implementation of these social protection programs and after the implementation of the social protection programs, with information about participation into these 3 different programs. So we were able to review this data and evaluate the effect of the social protection programs on the 3 questions that we're interested in. So to briefly tell you about the first research works that we conducted. So we know that social protection programs have been effective in reducing consumption poverty, and but we didn't just want to limit ourselves by looking at the money metric kind of poverty measures. We want to see whether or not these redistributive programs actually have effect on multidimensional aspects. So we followed the famous approach or counting approach as made more popular by works of Al-Khairi and her colleagues, mostly Al-Khairi and Foster in 2011. It's a counting approach to multidimensional poverty, where we select different dimensions that are relevant to the well-being of a household. For example, the education dimension would include schooling, achievement, whether or not children are attending school, nutritional outcomes, child mortality, the ability of households to have decent living, like decent home, sanitation services, cooking facilities, access to electricity, access to pure drinking water, etc. So we select these different dimensions, and then we count the number of outcomes that the household is deprived in or not having sufficient amount or acceptable amount of that particular outcome. So having this, by adopting this approach, we were able to identify who is poor And we also are able to know how much intense person's deprivation is. So we not only have the incidence of poverty, but also the intensity of poverty that individuals are facing. And on the right side of the slide, you'll see the very, very crude summary of our results. The results are very encouraging. First of all, when it comes to targeting, what we can observe from our sample survey is that on average, poorer households were successfully targeted by the programs. So if we compare the well-being indicators of participants and non-participants, we notice that participants are largely poorer than the non-participants. So targeting is encouraging. Multidimensional poverty declined over time. That's also another encouraging positive result we noticed over the 10-year period that we followed this trend. We noticed multidimensional poverty declined in all three countries for all three different social protection programs. We also noticed that both incidence and intensity of the poverty measures show progress. That is, we've seen a decline in intensity and incidence of poverty, but we also noticed something important where the effect we found was very large for those people who were severely poor in the beginning. So people who are deprived in at least 50% of the indicators that we consider, they seem to benefit the most from these social protection programs. When we look at the longer term effect of the programs, whether these effects were sustained or not, we also observe a very encouraging result in that impact on asset formation, school attendance of children, as well as some of the living condition indicators showed a sustained sustained improvement over the time. So this was an encouraging result, so to say. So, but the most important thing is that these programs seem to work largely for the severely deprived individuals, and this might call for a reconsideration of the amount and the size of the benefit, and probably also in the sense of targeting. Having this general look on the impact of these social protection programs on multidimensional poverty, we then moved on to zoom in to the household level. And we do this for an important reason, because normally we know that standard poverty measures are done on the household level. We usually assume that a household shares resources equally. And then we see that we target social protection programs based on the income consumption profile of a household. And this kind of masks a very important dimension to poverty, where we know that it's the individual that experiences poverty. And in economics, we have the concept of utility, and that utility is individual, and a lot of dimensions, a lot of outcomes affect that utility. So we wanted to focus whether targeting a household necessarily implies targeting everybody who is poor. And we also ask whether or not resources are equally shared within the household. We know that the households consume products, but focusing on resources on private assignable goods will give us a glimpse of the resource sharing pattern of the household. So that's what we focused on in this second part of our research project.
Yusuf, I might mention you got a couple, just 2 minutes left. So if you can, please make sure you're on time there in the 2 minutes. And for anyone who's watching, please send in your Slido questions via Slido. We'll be watching for them. Go ahead.
No, thank you, Chris. So having looked at the household more closely, we came across 3 interesting findings. First, we find that targeting poor individuals may not necessarily reach poor households. Targeting poor households doesn't necessarily reach poor individuals. This is the case because in our sample, both targeted and non-targeted individuals seem to have children who are severely undernourished, up to 40% within their ranks. So if our policy objective is to, for example, reduce child nutrition, we might need to reconsider our targeting strategy. The good news is, well, before the good news, there is some obvious predictable pattern. That is, men seem to have more resource share than women on average in all the 3 countries, more so in India and Peru. This resource shares decline when there are more children within the household, but the decline is not proportional. So women seem to lose more as the number of children within the household increases. But program participation comes in with some resource reallocation pattern in the data. And we see that participant households, in the participant households, there has some resource shift towards children, which is a positive thing. And we notice this by a decline in the nutrition level as the undernutrition level as the program goes on in the longer term. So there is a misbalance in resource allocation within the household, but the program induces some kind of resource allocation. And the last result that I would like to share with you today is about horizontal inequality. So we wanted to see we wanted to have some distributional lens on the impact of these social protection programs. So we wanted to see if the programs induced some change in equality patterns within and between groups. So we identified different socially and culturally constructed groups, such as ethnic groups, religious groups, in India, caste, and in Ethiopia, ethnic, for example, gender, as well as regional groupings. And the results are partially encouraging. First of all, targeting efficiency was good. When we look at exclusion error, because most of our households are on the poorer side, we notice a high exclusion error, which is poor people who should be targeted and not benefiting from the program. Right. But the encouraging part is there is low inclusion error, where people who are not poor are not benefiting from the program.
Lucy, you have one more slide to go on the recommendations. Could you go quickly to that? Maybe we can come back to it during the Q&A. Okay. We've got to stay on time, otherwise we're eating into time for Jaime. So, all right. 1 minute.
Okay, that's enough. So the takeaway from here is that the programs do not necessarily lead to automatic reduction in inequality within groups. Between groups, what we noticed is that most inequality is accounted for by within group inequality. So again, this leads us to the takeaways recommendations. We find that the programs are quite effective in reducing poverty among the severely poor people, which means that we might probably be looking at considering and increasing the benefit amount so that the benefit extends to less severely poor households. And we need also to focus on finely timed targeted policies to reach those actually in need of help. And we also need to pay closer attention to the patterns of inequality, particularly in socially constructed groups. And we need to pay attention to the health and household level inequalities in regions to successfully reach people who are actually in need of these social protection programs.
Great.
Thank you for your attention.
Thank you so much. I want to come back to that idea of targeting. I think that's really important to be able to better focus the aid to the people who really need it. I think we need to come back to that. But in the meantime, let's move on to Jaime. Jaime Aragon-Falamier, you are a researcher at the Université des Antilles, at the IRD, the Institut de Recherche pour le Développement. You're going to be talking about inequality and higher education, public and private. Please.
Thanks very much, Chris. So yes, in fact, I'm gonna start quite straight with our research program. I've been conducting the Argentina research team, so I'm here speaking in the name of around 20 researchers all over the world. The first thing we have to say is that we have done similar surveys were carried on in each of these countries with the same theoretical and methodological approaches. What one main objective, which I will divide for, this is, we wanted to see first the private higher education evolution. And within this, we wanted to see if we can identify some policies that are going to help to the private sector to grow up, mainly during the 90s. After that, the fourth element we wanted to know is if they consider inequalities, and then how do they fight against these inequalities? These four elements were part of the main objective of our higher education and inequality research team. In fact, we know that education policies can have the possibility of either reproduce social structures or change them. But sometimes we wanted to know what happened in the private sector. The documents we have been already published in the AFD website, online and free, so you can download them. I'm just here showing you some of them. But what's the context and the motivation for this research? First of all, because according to the UNESCO, those who have between 19 and 24 years old are enrolled at the level of high education. It's growing all over the world. So this is really important to keep it in mind, because in some countries, it's going to be maybe 11% in the Democratic Republic of Congo, 7% in India, Senegal, or Vietnam, 4% in Mexico, and so on. However, this growth, it's showing us deep social inequalities that we can characterize through different results that I'm going to present today. First of all, we have to keep in mind the inequalities that are still striking all over the countries to the access in these private higher education institutions. The second element is that according with the adjustment plan from the World Bank and the IMF during the 90s, 80s, they wanted to relieve public spending, and with a second assumption, which is taking out this public investment, it's gonna make that we're gonna open the private market in the education, which is gonna be regulated a little bit like Adam Smith will say, with an invisible hand. So the bad ones are gonna close the doors, and then the good ones are gonna still be working. 30 years later, we just saw that it's not exactly the case. Then the fourth element is that we're not able to see, it's not quite clear, the information about the policies from public to private in order to help or to reduce the inequalities. So this is just to show you two graphics that are gonna show how the inequalities are not gonna be in the higher education, but they're gonna start in the primary, but the higher education, it's not gonna solve this problem. You can see, for example, in Argentina and in Mexico, how since the primary school, we're gonna see this gap growing and growing all over the training years of these students. We can come back about Argentina because there's a small moment when in some professional or training, the gap is gonna get closer. But the main results, because that's the objective of this presentation, which ones we have? We have three main results. One of them, it's gonna be that there's a huge unregulated expansion of the private sector. The second, it's that there's a lot of barriers, new barriers that are not gonna allow everybody to get in. And then there's a diversity of quality.
Jaime, can I interrupt here? We've been kind of struggling trying to hear what you're saying because the signal is not very strong. It's very unstable. What we would like to do is to come back to you if we can, and I'm told we will launch the video, and then we will see if things work better and come back to you. Okay. We also want to hear from a little bit more from Holger Kula, and everybody who's watching, please send in your questions that we can get to after the break via Slido, and we're collecting them now. So please continue shooting them in to us. And at this point, I guess we're going to cut to a video, right? Okay.
From AFD, Agence Française de Développement, we want to tell you what the EU AFD Research Facility on Inequalities is, the projects we are carrying out, and our main research findings. The EU AFD Research Facility on Equalities is a programme funded by the European Commission and managed by AFD, aiming to improve knowledge and understanding of economic and social inequalities, their determinants and underlying mechanisms at different spatial levels, as well as the most effective policies and approaches to reduce them. With a budget of €4 million for the period 2017 to 2020 and a steering committee comprised of the European Commission, AFD and AECID, the Spanish cooperation, the programme launched more than 20 research projects in over 20 countries. This facility also aimed to engage in a joint reflection with member states on ways to strengthen the contribution of EU development cooperation to the fight against inequalities in the framework of the implementation of Agenda 2030 and to contribute to EU development policy whose overarching objective is the eradication of poverty. The objectives of this facility are achieved through a three-pronged strategy. 1. Conducting research on the determinants and dynamics of economic and social inequalities in developing countries. 2. Targeting our work in partner countries that have expressed an interest or need. 3. Support partner countries and development institutions to integrate research findings into national policies and development cooperation strategies. Did you know that the EU AFD Research Facility on Inequality has produced over 100 research papers and policy briefs? All these articles analyse the links between inequalities and a wide array of topics such as education, health, labour markets, housing, taxation and climate change. These research publications, the support to the structuring and the strengthening of research networks on the topic of inequalities, further supports policymakers and development in mainstreaming and tackling the reduction of inequalities in their policies and strategies. However, the main point we would like to share with you is that we have observed how generalised are the effects of inequalities for societies, how unequal access to public services lowers the willingness to pay taxes, how unequal access to stable jobs creates poverty traps and exclusion, and how inequality shapes perceptions and the willingness to cooperate. So, how can we help strategies to reduce inequality? Through the development of new tools such as the inequality diagnostics, and the expansion of existing tools such as the fiscal incidence analysis and the multidimensional inequality framework, The EU AFD Research Facility on Inequalities supported the governments in partner countries and the civil society in building evidence-based strategies to reduce inequality. All these results have been presented at conferences, such as the 2018 International Conference on Inequalities and Social Cohesion, in national workshops and stakeholders events, such as those organised in Bolivia, Mexico, Tunisia and South Africa, in a series of webinars organised in 2020, and of course, in this final conference. In this final conference, beyond the presentation of all the results of the facility, there will be an opportunity to launch a second phase of reflections and partnerships that will be articulated in the extension of the facility over the period 2021 to 2026. We will be supporting 4 countries, Colombia, Indonesia, Mexico and South Africa, to design and implement policies to reduce inequalities. Will you join our goal to reduce these inequalities? Help us share the knowledge on reducing inequalities.
So welcome back to our discussion on public-private, and I think, Jaime, you have a different set of headphones, so I think your signal is going to be much better. And let's continue then with your presentation, please.
Yes, thanks a lot, Chris. Okay, so I'm gonna continue with the results I wanted to present to you. So one of them is that we can see that the private higher education have been having an expansion, a rapid expansion since the 90s mainly. This have been deregulated, diversified, and quite heterogeneous. So we're not able to speak about the private sector as one. At least that's one of the conclusions we arrived in these studies we managed. So we can see that this huge inequality between the institutions can be seen between institutions, between the countries and within the countries. Just for example, according to the UNESCO again, the private sector, it's growing and growing up. For example, 60% in India of the students in the higher education are in a private, 13% in Vietnam, 22% in Benin, 25% in Argentina and Mexico, and so on. But one of the main things we have seen, we have had as result, it's that the quality, it's gonna at the same time have a huge gap from those who have really good research laboratories and those who have just small and tiny institutions. The second element I would like you to mention is that the conditions of access are not the same. So most of the institutions have different ways of access, and sometimes they're gonna have these meritocratic and economic barriers for the elite institutions. The third element is that the labor market after the training studies, it's not gonna be exactly the same. So this is one of the main things we have seen. We can see, for example, in this map, how in Peru and then in the Democratic Republic of Congo, there's been a huge expansion. So there is private and public sector all over the country. And the private is gonna be normally more important than the public in one hand. In the other, we can see that the high quality institutions are gonna be based in the capital cities, mainly Lima or Kinshasa. So this is at the same time gonna structure a different and a new inequality. The second result we had is that there are some new barriers, economic and cultural, and we have to keep them in mind. So sometimes they're gonna be, for example, if we say that the private sector have helped to get access, especially to lower and working classes, this is not synonymous or translated as a reduction in inequalities of access, of conditions during the academic training, or in the integration of the labor market after the studies. It's going to have a huge difference between the elite and the working class institutions. We can see that these barriers are going to be based normally in this meritocratic or cultural background that the students already have from their families. The second element is that this is going to structure a division between the elite and the working class institutions, and sometimes they're going to be competing, but other times they're going to be be competing with the public sector. We already saw that at the end, some small institutions based for the middle or working class sectors are going to have a devaluation of the diploma that in the labor market are not going to be accepted, unfortunately. We can see this, for example, this is the second case, for example, in Senegal, there's not a single private or public institution in the east of the map, as you can see here. That's going to show us that for Senegal, again, the institutions are going to be based mainly in Dakar, so it's at the same time going to fracture from a geo-spatial or territorial way. We can see at the same time in the graphic to the left, in the case of Mexico, how the upper classes can access to the elite private universities and how those who belong to the middle and the lower classes are not going to be able to access to this. So we can see how the yellow one, it's going to be quite on top, and then the orange, which is the middle and the lower classes, are not going to access to these institutions. The third main result is that we can see that there's a huge contrast between the public and the private, and we're not able to say that in many cases it's the same case. So, for example, in the private sector, we have sometimes a lot of regulations, some accreditation according with the state that it's gonna prove and it's gonna guarantee a sort of a quality in the institutions. In some others, there's not gonna be a single control from the state. This is gonna differ logically from one country to another. This is gonna show us that the private sector, it's completely heterogeneous all over the world. We have to say that at the same time, in some countries, they have policies to address inequalities. For example, in Mexico, Peru, and India, they have this affirmative action in order to include minorities. Sometimes in Mexico and Argentina, for example, also the state can give scholarships for students to go to the private. This is gonna help them to avoid the economic barrier, but it's not gonna help them to avoid the cultural or the meritocratic barrier. Just again, to give an example, Vietnam, we can see both cases, the Democratic Republic of Congo and Vietnam. In Vietnam, it's so complicated to open a new private institution. That's why the public, it's gonna be dominating the market of the higher education. We're gonna have a lot of control from the state with this accreditation, which is gonna give us as conclusion to have a highly competitive sector from private and from public. We have to mention that both of them can have finance from the state, which is not the case from all the countries we have done this study. And then in the other side, we can see how it is for the Democratic Republic of Congo, which have a completely heterogeneous system of accreditation, approved, provisionally approved, etc. But we can say just globally that 30% of the institutions nowadays working in the Democratic Republic of Congo are waiting for an accreditation, but they're already giving diplomas. And we don't know if they do have a quality to give them and to have this training formation for the students. So which ones are our recommendations? And with this, I'm gonna start to conclude. We have to take into account some elements. For example, we should regulate this huge expansion of the private higher education market. We're not able to leave it just like an invisible hand who is going to be regulating, because sometimes middle and lower classes don't have the access to the information to know if one or the other institution is going to be better. So we have to have a good definition of the conditions of opening new private institutions. And this is gonna give us a little bit like a quality from the new private institutions. This is gonna have to be at the same time with this expansion of the territorial sectors. So the public sector have to have institutions all over the country. If not, it's going to be the private who's going to take all that population. The second element is to reduce this huge heterogeneity between the institutions in terms of access and academic trajectory. What's the objective? To try to level, to try to fight against the inequalities that the market have done, but in order to get, in the moment they get into university, we can level from one side in the economic point of view with scholarships, but also we have to find some new strategies to avoid these meritocratic or cultural barriers that most of the time the students are not able to avoid. And then maybe to try to harmonize the teachers' qualifications, because this is another dark side of the private sector, because normally the teachers are just like lecturers. It's rarely that they have a full-time position, and this is going to be quite linked with the quality of their teaching. So we have to give at the same time this sort of leveling in the teacher sector. And this is going to be, and the third one is to adopt its incentives to improve certification, to make the private sector to have the certification, this accreditation from the state, which is going to help them to have a quality, but to keep the quality during the training and the next years. Thank you very much for your attention. And if you have any questions, don't hesitate to ask me.
Well, thank you, Jaime. And also important, your point 4, increasing resources for public secondary education. Obviously, that's also very important. We have some questions in, and I know that Shahra, you want to talk about targeting, and as we had been talking with Youssef. But let me get to a couple of the questions. I'd like to encourage those who've been watching to send in more questions. We still have until the top of the hour, until 1700 CET. So send them in through Slido and send us more. One question I have here, I'm kind of going back, is for those who were talking about income, and there were a few of you talking about income, could you reflect on how the effects of a universal basic income, a UBI, could compare to those of the programs that we discussed today? Would someone like to comment on that, on UBI?
Can start.
Okay, Youssef, go ahead.
Yeah, it's an interesting question, and it's also a very interesting and nowadays widely discussed idea. But in terms of the programs or the countries that, for example, our project studied, setting aside the political and ethical argument towards universal basic income, the practicality may be a little bit challenging to make it clear, UBI, when you go for universal basic income, you need to finance it, and the main important source would have to be domestic taxation, domestic sources. And in most of these developing countries, a large proportion of the people are in the informal sector, in the outside of the tax net, basically. So there won't be enough resources to actually finance this thing, and I'm not sure. Depending on the overseas development aid is gonna cut it. So there is that challenge, but the idea is currently in the fore and people are debating about it.
Right. Well, Yusuf, I mean, you raise this issue of tax. Lisa, what do you think? Is there a way to structure taxation so that it becomes that sort of transfer to UBI?
Well, I think maybe Mouksit can have some insight on this question. This is really a question of how redistributive is taxation, and depending on the tax mix that the government is going to choose, you are going to achieve different objectives. So I don't know, Mouksit, if you can.
But I guess it's all not only a question of taxation. I mean, a mix of taxation, I guess, but also maybe international support, right?
The issue with international support is going to be probably a political economy issue in this domain, and it's probably difficult to achieve such an objective as universal income through external financing, right? It's going to be difficult from a political economy point of view. No, I don't know.
Yeah. Is Akim available? Is he connected again? He's disconnected. Okay. Well, then, would anyone else like to talk about universal basic income? Yeah, Shahra, go ahead. Turn your mic on.
Yeah, my mic is on now.
Oh, it's on. Okay, sorry.
Thank you, Chris. Yeah, I do want to actually talk about both UBI and targeting.
Okay.
You see, the point with targeting, it sounds like a really good idea. If we have scarce resources, we have to deliver it to the very, very poor. But the problem is that, in fact, in practice, targeting has not worked. And there's 3 reasons for that. One is we have very good studies that show that there are huge exclusion errors, particularly in the kind of countries in developing countries where you have very limited data and information. There are these so-called proxy means tests, but there are huge problems with it. And I do refer everyone to a really good study that was done by Stephen Kidd in 2019 it's called Hit and Miss. And what he showed is that out of 25 programs with coverage, which had coverage, about 12 of them, that's almost half of them, had exclusion errors that were above 70%, i.e. they were missing almost 70% of the people they were supposed to target. And 5 of the 25 had errors of above 90%. So there are huge problems in targeting because of the problem with having the right data and the right information. And also there is quite a lot of evidence that in particularly developing countries where poverty is extensive, when you target the poorest of the poor, it also divides communities. It creates a lot of tensions because people don't understand how come this person got it and I didn't get it. So that's kind of at the practicalities of targeting. Then we also have this problem, again, because of in countries where you have extensive poverty, you have what we call the missing middle, a huge group of people who work in the informal economy, who are not at the very bottom to get targeted, get assistance through targeting, but who also are not well enough to be contributing through a kind of contributory system. So you have a very large percentage of people who are missed out of systems that are based on targeting. And then finally, there is a political economy argument for why targeting doesn't work. There's a really good paper by Joachim Palme, a very well-known Swedish welfare state economist, and Walter Korpi, called The Paradox of Redistribution. The more you target programs, the less redistribution you have. The more you try to go for the very poor, the less you have. Why? Because when programs are targeted to the very, very few and very poor, they become poor programs because people are less willing to pay taxes because they don't see benefits from the public services and transfers. Whereas in a more universal program, you do see the benefits, so you're more willing to contribute taxation. That's kind of the lesson from welfare state history as well.
Okay.
And I want to just add in one point here. Not going for targeting and talking about universality doesn't mean a UBI. Because the problem with the UBI is it says everyone should get the same thing. Whereas in the sort of ILO, I can say social protection system conceptualization, you get support when you need it. If you are unemployed, if you are pregnant and have a childbirth.
Yeah,
so it's universal, but depending on the need that you have, rather than saying, let's have the same universal income for everyone, which because of the whole issues around political economy, it will become a tiny little small benefit, which is not really going to address the kind of needs that people have.
I've got a few more questions, but I think, can I tap you, Holga, on this one, on targeting and universal basic income? Would you like to comment briefly, please, on that?
I mean, let me come back to that issue of informal economy, informal, let's say, sector, because it is, I would say, in all those countries we talk about, that's a major, let's say, to be honest, that's a major economic domain, but we ignore it completely. It is not on our, let's say, on ours, on others, let's say, donors' activity sheet, you know, because we speak with the informal sector, we try to support it, we bring money there. So coming from a sort of implementation-driven background, I would ask you and demand, let's say, the organizers of the next phase of that research program to work exactly on the question, what is that about? What is the informal sector? Because what Razavi just said, it's not just one type, there are many types. So, because at the very beginning of our discussion, there was a proposal, yes, we have to expand our taxation basis. There might be some, of course, within the informal sector, they are able just to contribute, but many are not. But that needs to be understood. So that's one of the, let's say, suggestions I would share with you to work on that. And to give, by the way, to give the formal and to highly formalized international development agencies a sort of, let's say, clear understanding and even a sort of roadmap, how to act, what to do, you know, and not to ignore them anymore. And then actually, that's interesting what you just said about this universal basic income, because also based on that, because I'm convinced, personally, that many people in the informal sector are the first target of that kind of, let's say, universal income. But as you said, maybe it's not a sort of stand-alone issue. It's not a standard program. It has to be customized. I also
can you wrap up quickly, because I've got questions here I'd like to pitch.
I'd like to come back to that previously mentioned issue about the public-private partnerships.
Okay.
Because the major question is also what domain we have to focus on when it comes to the private. Even here, I would say there are so many opinions, even in our countries in the global north. There is that myth, the private does everything, or the private-public partnership is the solution. I would say, and plenty of, let's say, books and articles show and experiences show, there are some areas, some domains where that is actually true, but there are others that it's not true. Let's speak about, as we are now driven by that COVID pandemic, there is the area of hospitals. There's evidence. I can just mention evidence in Australia, for instance. When it comes to the hardware of hospitals, that makes sense to give pieces to the private, to the hardware. But when we discuss about the software, you know, how a hospital has to run, the nurses, the medicine, that is a public domain. It cannot be, not because I think that, but because that's evident of experiences, that cannot be a private domain. So that's why I think also here maybe it could be a fantastic issue to deep dive in those experiences, also in all those countries you have around. Where does it make sense to give a sort of evidence what has been done so far, what are the lessons learned? Otherwise, we are always trapped in that pro and con, and we don't have any overview. That's the second, let's say, request I would put at that table.
Before I get to that next question, Manuela, Holger was touching on healthcare. Do you want to kind of react to what Holger said? Oh, turn your mic on. Your mic is still off. Still can't hear you. Can you try to click it back on? Okay, maybe you can, yeah, let's move on. While you're checking on that, I have a question for Jaime. There was a question coming in on that for him. In the public-private duality, how do you manage to keep regulation relevant enough to both address educational needs and reduce inequities? Tricky, isn't it?
Yeah, definitely. Well, first of all, the regulation is going to give us, I try to conclude this sort of leveling between the training and the university years. So what's the main thing? It's that normally the public are going to have this sort of accreditation or this way of regulating how and which how they're going to have a sort of quality, and then the private, sometimes they're not going to have this sort of regulation. I don't know if they wanted to hear about this accreditation, because it's one of the subjects more interesting and it's more complex for us also, because each country have their own way to give this sort of accreditation. So if we don't have a sort of homogeneous way of giving an evaluation to this or that institution, we're not going to be able to have a quality standards that are going to be respected.
Okay, good. Let me move to another question. This one, we can start with Lisa for this one. Do you think that your results on the impact of fiscal consolidation could inform future recovery strategies, especially in the context of the increase in COVID-related indebtedness?
Yes, this is really something we want to examine, how the results that we found. It was a year before COVID, so we did this research before the crisis. But we had in mind the re-indebtedness of Africa when we were doing this research. So it was already an issue how to achieve the fiscal balances, and if government were to implement austerity measure, what would be the human cost? So we had that in mind already, but this is of course reinforced with the current crisis, which will probably put a lot of pressure on government budgets, and this is something that we need to examine more in detail, how the spending cuts. And if we can find data on that, the kind of spending cuts, how this affect child mortality on average, but also child mortality with respect to the inequality issues that we were discussing, that is child mortality for the poorest and the richest segment of the population. So my answer would be yes, we will need to look a little bit more on the kind of tax of spending that matter most to provide some answer. But this is what the research suggests, that this human cost should be taken into account when designing the austerity measures that sometimes are required.
You wanted Mouksit to jump in on this as well, didn't you? On a previous point, but hey, we can ask Mouksit as well about this. Do you think this fiscal consolidation could inform future recovery strategies, especially in the context of the increase in COVID-related indebtedness? Mouksit, would you like to comment on that?
Yeah, sorry. Yeah, about COVID issue, I think it's an important question on consolidation, because the COVID-19 has put a lot of pressure on especially finance public. And this is a question we need to think about. And I see that like the main challenge is, I mean, we have on the hand the negative consequence of the COVID-19. On the other hand, we need to address these issues, but at the same time, we face a lack of resources. So I think, yeah, it's very kind of
apropos, as you would say, right?
Yeah. Yeah, but our research suggests that, I mean, when we did this research, the research, it was about before the COVID-19 happened. But I think that there is a room to improve the domestic resource mobilization and then to limit the fiscal consolidation. And especially for the indirect taxes, there is a room to improve that, to make this more progressive. And one way to, a further step of our study is to go further to analyze this indirect taxes, because there are lot of exemptions. Maybe we should more target the exemption, and we should be more able to tax rich people, and then we can raise funds to face the COVID-19 issues.
Okay, I mean, continue on with that thought about the COVID impact. Do you think this is another question, do you think the current crisis will increase demand for redistribution and stronger social protection?
Absolutely.
Yeah.
I think so. Absolutely. And the demand is even more important in sub-Saharan Africa, because in sub-Saharan Africa already we lack social protection. There are, I think, the household benefiting social protection in sub-Saharan Africa is the lower in the world. And yeah, so the social because COVID-19, it's a huge shock, it's employment shock, a demand shock. So absolutely, we need that would increase the demand for social protection. Yeah.
I'm coming up 3 minutes away from the top of the hour. I'm given a bit of poetic license to move to go a little bit further if we have to, but I think we're in sort of the final comments mode. Manuela, though, we have a microphone on you now. You took your headphones off, and I think we can hear you probably, right?
I'm not sure. Can you hear me now?
Yes. Oh, yes. Music to my ears. So, I mean, I wanted to come back because we're in the middle of a health crisis, and dealing with this health crisis and trying to seize this moment to move things in a different direction with the help of both public and private. Final comments on how you see the health care sector as a way to change things.
Wow, that's a very difficult question to answer. I wish I had a magic stick and I could answer that. I think COVID has been a tremendous challenge, and I would like the challenges turn into opportunities to think differently and to think different in terms of social protection. And actually, we are just starting research. We're planning a qualitative studies to look at how countries are rethinking their health financing policies in light of COVID, and whether they've taken COVID, the funding that has come via COVID, as an opportunity to rethink health financing structures and use this as a catalyst for change. But to be honest with you, I don't know what we're going to find out. So I don't actually know if this is going to be a shock and it's going to leave us all broken and with poorer social protection, or if we're really going to take the opportunity to understand that health is really central and use it as an opportunity. And then I would like to reiterate what my colleague just said, especially in sub-Saharan Africa, we really need better social protection in general. And we should really build on this momentum to go further with it.
And Luciev, I think I need to get a bit more of your input and feedback on this, because we've been debating this idea the last half an hour about targeting. what's your last word on targeting, and how does this current crisis impact on that? Is this an opportunity to target better?
So with targeting, there is good news, and there is also something to look out for. So the good news is most programs, the targeting is good. I mean, people who are actually benefiting are those who deserved the help, who needed the help the most. But we're not reaching everybody, and there are considerable amount of people who needed the protection and not getting it. So yes, the exclusion rate is very high. So on that note, there is more to work on, but the existing programs seem to do better when it comes to targeting. So there is some encouraging trend in that respect. But again, depending on what our objective is, our targeting also should be geared towards that particular object. In our example, for example, if your interest is to reduce child undernutrition, then targeting household level poverty will not do it. So there is a huge inequality within the household. So targeting should be fined and finely targeted. So there is that to look out for.
Okay, Holger, maybe a final word briefly. But this is all about tapping all your brains for AFD, the Agence Française de Développement, to decide how to better target its aid, its help, its assistance. And what should the takeaway be from this public-private discussion?
I mean, I would say, as you talk to the Agence Française de Développement, and it's a donor, and to talk now also to me as a representative from the technical, let's say, international cooperation. Here, I would say this is also a big and huge question to both of us, to those who are very active as donors and to those who are very active as technical, let's say, cooperation agencies and colleagues. We have to, that's a message to the global north, we have to work on our future interaction cooperation, because it's not only about money, it is about money, as we said, of course, but especially to ensure that the very last mile is ensured, that the money sent to our partner countries gets through that very last mile to the targeted people and groups. This is something which is not done by, let's say, management of budgets. Here you need technical cooperation, be it about regulation, be it about approaches how to, for instance, involve local communities as a sort of, let's say, beneficiaries, or even how to reorganize and to organize intermediaries and so on. So that's, first of all, also a question to us. How do we organize our work? And I think there is plenty of things to do.
Okay, I think I would wrap this up now, unless somebody has a burning need to say some final word. Is there anyone? Please raise your hand if you would like to say some final word. Shahra, please.
Sorry, I do want to be very brief, but okay. I do think, like everyone said it, I think we are at a crossroads, particularly in terms of social protection, investments in health and social protection measures. On the one hand, we have seen the importance of having a social protection system in place when a crisis hits, because countries that didn't have it had really to struggle to put something in place very quickly. On the other hand, we're also at the very high risk of having to go through another period of fiscal consolidation and austerity. So I think either we don't go for another decade of austerity and we continue to invest and be better prepared when the next crisis hits, and we know that the climate crisis is around, or we miss that opportunity and really not do the investment and the building of systems that is so much needed. Thank you.
That's a wonderful final word. I think we'll leave it at that. Thank you so much to all the speakers on this, just this one part of several days of discussion on where we go with AFD and the rest of the aid and assistance community, the development community. Tomorrow is the final day. There will be a panel discussion, focus on the political economy of inequality reduction, and lots more networking, which is very much a part of this. at this final conference of the EU AFD Research Facility on Inequalities. Keep in mind the links to all the studies that were presented in your session are going to be going on the Slido, so watch out for that. All these discussions throughout this conference are recorded for playback, so keep that in mind too. So thanks so much for being a part of it as a speaker, as those who sent in questions, as those who watched. And we'll see you tomorrow. Thanks very much.